Memedicine Cram Acyanotic Heart Disease, Flashcard Set 27, Fetal Circulation. And this is a depiction of fetal circulation. In addition to the fetal heart and lungs, we also have the umbilical vein where oxygenated blood flows. I know it kind of seems backwards. And we have the umbilical artery, these purple things, all right, where mixed and deoxygenated blood flows, okay? This deck of cards can be used for review for the National Council licensure. The healthcare provider is caring for a patient with a congenital heart defect and is reviewing fetal circulation. Which of the following statements most accurately explains the major difference between fetal circulation and the circulation established at birth? Select all that apply. Is it A, oxygenated blood flows from the placenta through the umbilical vein to the fetus? Is it B, when the umbilical cord is cut, the foramen ovale opens to allow more blood to the lungs? Is it C, in the fetus, the ductus arteriosus diverts most of the blood away from the lungs? Or D, the ductus venosus closes after birth, so blood is no longer diverted from the ventricles to the atria? Or is it E, systemic vascular resistance is lower than pulmonary vascular resistance in the fetus? I'll give you a moment to select all the major differences that apply. All right. Okay, so fetal circulation is characterized by 3 shunts designed to increase the flow of oxygenated blood to the fetal heart and brain. Only a small portion of oxygenated blood is circulated to the fetal lungs, okay, which are filled with fluid and where vascular resistance is pretty high. These arrows indicate the vascular resistance, shunting blood back to the heart. When the umbilical cord is clamped, the fetal shunts are no longer necessary. All right? And all these shunts begin to close. So the foramen ovale, the ductus arteriosus, the ductus venous, all these things begin to shut down. Okay? As the lungs begin to fill with air, pulmonary resistance will decrease and systemic pressure will increase. Instead of gas exchange occurring in the lungs, the placenta is the exchange organ for oxygen and carbon dioxide. So the baby's carbon dioxide and oxygen, is all exchanged in the mother's blood, actually. Oxygenated blood flows to the fetus from the placenta through the umbilical vein, okay? Deoxygenated blood returns to the placenta through the umbilical arteries. And of the choices given, the major differences between fetal circulation and post-fetal circulation are going to be that systemic vascular resistance is lower than pulmonary vascular resistance. In the fetus, the ductus arteriosus diverts most of the blood away from the lungs. Here, these arrows indicate diversion away from the lungs, unless oxygenated blood flows from the placenta through the umbilical vein of the fetus. So these are the correct statements about the major differences. Okay? All right.